Do you frequently feel like your child isn't growing or moving the way other kids do? Maybe they have trouble sitting up, walking, or even feeding without choking. Or perhaps their belly looks swollen even though they're not eating much. These might seem like small things at first, but they could be signs of a rare disease hiding in the body, like Niemann-Pick disease. It's not something you hear about every day, but for the families affected, it changes everything. This disease affects how the body handles fats, especially in the brain and organs, leading to serious health problems over time. Imagine your body's cells have tiny recycling plants inside them, called lysosomes, that break down waste like fats and cholesterol. In Niemann-Pick, these recycling plants don't work because of a broken instruction manual, a faulty gene passed from parents. Because of this, fats, especially one called sphingomyelin, start piling up like unopened mail in a mailbox. Over time, this buildup poisons the cells, especially in the brain, liver, and spleen. There are different types like type A, B, and C, and each has a slightly different genetic glitch. But the result is the same: the body can't clean itself properly. How do you know if someone might have Niemann-Pick? Think about a baby who seems floppy, doesn't hold their head up, or keeps having trouble eating and breathing. Or a child who is learning to walk, but then starts falling more and more, forgetting words or staring blankly, almost like a video slowing down. Parents might say, "My child used to smile and play, but now they're tired all the time." The liver and spleen often swell up, making the belly big. In type C, a doctor might notice vertical eye movement issues, like the child can't look up or down easily. These signs creep in slowly, which makes them easy to miss at first. How do doctors find out if it's Niemann-Pick? Let's say a child has a big belly and delays in development. The doctor might order a blood test or a skin sample, a small piece of skin grown in a lab, to check how cells handle fats. For types A and B, they look for low levels of a cleaning enzyme called acid sphingomyelinase. For type C, they might do a special test to see how cholesterol moves inside cells. Genetic testing can confirm the exact gene error. Now about treatment, there's no full cure yet, but some options help. For type B, enzyme replacement therapy, like getting a missing cleaning crew delivered by IV, can help lungs and organs. For type C, a drug called miglustat can slow down the damage by reducing fat buildup. Physical therapy, feeding tubes, or speech help can also improve daily life. Can we prevent Niemann-Pick disease? Since it's passed through genes, you can't prevent it after a baby is born, but you can be prepared before. Imagine you and your partner are planning a family. A simple blood test can check if you both carry the faulty gene, like checking if you both have a typo in the same instruction manual. If both do, there's a 1 in 4 chance your child could get the disease. You can then talk to a genetic counselor, a kind of doctor who helps you understand your risks and options, like IVF with gene screening. While you can't change genes yet, knowing helps you plan with love and care. Scientists aren't giving up. Right now, they're testing gene therapy. Imagine fixing the broken instruction manual in cells by sending in a correct copy through a harmless virus. Early trials show some kids with type B have better breathing and growth after this. For type C, new drugs are being studied to help move cholesterol properly. There's also work on biomarkers, like finding a clue in the blood that shows how fast the disease is moving, so doctors can act sooner. Families around the world are joining registries and sharing stories, helping researchers see